Atrial flutters beta, let me tell you what happens in this. Comparing to sinus arrhythmias, which we discussed, sinus tachycardia, sinus bradycardia, the only problem was increased or very much decreased beating of the heart. But at least that was sinus rhythm. It was sinus. It was being produced by the SA node and it was followed through a normal pathway. Only the beating capacity was increased due to the sympathetic bulge. Now comes the atrial flutters. In this, there is the presence of the ectopic foci in the heart, usually within right atrium encircling the tricuspid annulus. You don't have to remember the exact location, but at least you need to know in atrial flutters there is the presence of the ectopic focus, there is the re-entry circuit, there is the triggered activity. So that means if you are discussing the atrial flutters, what will happen is, if this is your heart, beta, you see over there, and this is the SA node. But alongside SA nodes, you will find some other foci too. This is the foci. And they are producing the impulses, right? And you can see the re-entry circuit too. So all those three components of the triangle are present over there. So if you read over there, there is the presence of the macro re-entry circuits, multiple foci, leading to the atrial rate of 300 per minute, right? Isn't it very much interesting to study, beta? What happens in this is, let me tell you, there is presence of multiple foci, and you can see this is the foci other than SA node, right? And these foci produces impulses at a rate of 300 per minute. Ectopic foci are there, firing at a rate of 300 per minute, creating a large re-entry circuits with the triggered activity too. And if there are some foci present in the heart, in the right or left atrium, or even around the tricuspid annulus in particular, and they are firing at a rate of 300 per minute, and they are producing that much atrial contractions, what changes are you expecting on ECG? If there is something present in the atria, named as ectopic focus, firing at a rate of 300 per minute, sometimes it is associated with the AV block too. What changes on ECG are you expecting? Let me tell you this thing on the very next slide. There we go, with some ECG changes. Again, beta, I am repeating it for so many times because I need to be very much clear with the pace at least. What happens in the atrial flutters? There is presence of the ectopic foci, which are producing the impulses at a very high rate of 300 per minute, and those impulses are creating the big, large, macro re-entry circuits. The circus motion is there, and obviously the triggered activity too. And most of the times you will find a patient of the atrial flutter with a heart block too. Yeah. So now you guys have to be very much smart, and with applying all the concepts, you need to know if there is something present in the heart which is beating at a rate of 300 per minute, what the hell are the changes you will see on ECG? Obviously something present in the atria beating at a rate of 300 per minute, it will produce lots of atrial contractions. And is it a sinus rhythm? No. It is said to be sinus rhythm when the beat is produced by the SA node. Here you have got so many ectopic foci beating at a rate of 300 per minute, producing lots of atrial contraction. What will be the ECG changes? Lots of P waves, because P waves actually represent atrial contraction. Now you have something in your atria which is beating at a rate of 300 per minute, right? You have got something in your atria beating at a rate of 300 per minute, which is producing lots of atrial contractions, and atrial contractions are represented by the P wave, and you can see the changes in P waves. So many P waves in a line, that means so many atrial contractions. So many atrial contractions. These are nothing but the flutter waves, sawtooth flutter waves. Sometimes it is difficult to identify these flutter waves because they are buried in the QRS complex. Yeah. So we have to block the AV node that in that cases, so that we can better see the flutter waves by giving different drugs. So if you want me to show you, you can see this atrial flutter. You can see after at least 3 P waves, you can see beta the flutter waves, and then a QRS complex, flutter waves, and the QRS complex, right? Okay. So the thing is that these are the P waves. If you see so many P waves and a QRS complex and a T wave. The thing is that there are lots of P waves. Why? Because there is lots of atrial contraction. Why there is lots of atrial contraction? Because there is something ectopic present in your heart which is beating at a rate of 300 per minute. Right? Sometimes these flutter waves are too much that they are buried in the QRS complex. You have to block the AV node. You have to stop the QRS complex, then you can better see the flutter waves. So I hope you are clear with the ECG change. Look, this is the QRS, then one P wave, another P wave, and then QRS complex, 1, 2, 3, and then QRS complex. So lots of P waves are there basically. Clear, beta? Okay. I told you sometimes they are buried in the QRS complex. So in that case, you have to actually block the AV node and stop the QRS complexes being formed on the ECG. Then you can better see the flutter waves. And you can block the AV node by the carotid sinus pressure, IV adenosine, right? That's it. अगर जाहिर सी बात है बेटा, आप एवी ब्लॉक करोगे तो इम्पल्सेस नीचे नहीं जाएंगे तो क्यूआरएस कॉम्प्लेक्स नहीं बनेगा, क्यूआरएस कॉम्प्लेक्स नहीं बनेगा ईसीजी पे तो आपको पी वेव्स बहुत अच्छे से दिख जाएंगी, दैट आर इन दिस केस द फ्लटर वेव्स. Finally, beta, now comes the management. If somebody is suffering from atrial flutters, what is going to be the treatment? The treatment protocol should be beta. Yeah. In this case, the rate is very high, 300 per minute. You have to start with the direct current cardioversion, DC. Right? Following cardioversion, फिर कुछ ड्रग्स की तरफ हम आते हैं जैसे कि बीटा ब्लॉकर्स, amiodarone, right? Amiodarone is antiarrhythmic and beta blocker for red control. Okay, you can use few more antiarrhythmics other than amiodarone, but at least do not use class 1C antiarrhythmics like flecainide, which is contraindicated because of risk of slowing the flutter circuit. All right. Another very interesting method is the catheter ablation. This is highly effective treatment. This is the treatment of choice in patients with a persistent disease. With the catheter ablation, what you do is you ablate, you destroy the ectopic foci which are producing the abnormal beats. So in short, the management of atrial flutters is, you can go with the, if the patient is unresponsive, go with the DC cardioversion. And following the DC cardioversion, you have to give the patient with the beta blockers or antiarrhythmics like amiodarone. But at least class 1C antiarrhythmics, flecainide is contraindicated. The best effective treatment is the catheter ablation, right? This is all about the atrial flutters. An ectopic foci present in the heart, especially around the tricuspid annulus. Firing rate is 300 per minute, creating the large re-entry circuits and the triggered activities. Right? Most of the times associated with the AV block. And you will see on the ECG, there is something in the heart producing firing at a rate of 300 per minute. It will produce lots of atrial contractions, uncoordinated, and lots of P waves, obviously, which you will see on the ECG as flutter waves, sawtooth waves, and sometimes they are so much that they are buried in the QRS complex or T wave. For that, you need to actually create the AV block so that you can stop the QRS complexes appearing on the ECG and you can better see the P waves. And this AV block can be done using IV adenosine carotid sinus massage. Right, then I took you to the treatment of the atrial flutters. The treatment was go with the direct current cardioversion followed by beta blockers and amiodarone. The most effective therapy can be catheter ablation of all the extra foci. That's all about the atrial flutters. Now, beta, I'll be taking you to atrial fibrillations, the most common ones.